to the Medical Receptionist Network podcast show. I am your host, Shivhon Adkins. Join us as we discuss the importance of clerical and administrative roles and their impact on the healthcare industry. Thanks for being here. Thanks for joining us.
Hello, my name is Chris Sneed, and I've been in healthcare for about 11 years now. I work for Kaiser Permanente. I started off in OBGYN department, then I went to the oncology department, and I'm currently working in pediatrics. So I've been in pediatrics for a couple of years now.
Oh, wow. That's interesting. I actually started in obstetrics as well, and I work with a pediatrician now too, so that's very interesting.
Wow, what a coincidence.
Yeah, definitely. And it's two different worlds. You would think it's so similar, but it's very much two different worlds, right?
It really is. Yes, it
definitely.
is.
So now you're still in the hospital system. Right now you're in pediatrics, correct?
Yes, I am currently, and I love it. I love working with the kids, the little babies.
Oh, yes, I'm sure. What made you become a receptionist in the first place? What guided you to that career choice?
I needed a job. No, you know what? I love working with people. And, before that, I was a cable guy. So on top of roofs, going in attics, hooking up cable. And I was like, you know what? I'm tired of this. I want to smell the same way when I go into work, when I leave from work. And I said, so working at the hospital, I'll be the same way. I'm not getting dirty. I still get the same feel of customer service and working with to jump in healthcare. So, and when I got in healthcare, I was like, oh, this is amazing, because I realized people go through all kind of things and we don't know. And for me to work in oncology, was just such a blessing, man. People are going through what they're going through, getting chemotherapy, and I built a lot of relationships with patients, and I made them feel better about the situation, made them laugh, and just and my compassion and my sympathy for people was is what I was concerned about. So that's what made me jump in it.
Well, that has to be tough at times as well, though, even, trying to lift people up in some of our toughest times.
Oh, yeah, absolutely it was. But, people go through so much, and you never realize you putting a smile on somebody's face, how that can change their life. Definitely.
And, putting a smile on someone's face means more to most than you would even think. So how have you, in all these different specialties that you've worked with, how have you been able to enhance, like, the front office process, or, have you had to bring ideas to your, management or organization to help, the process so that it's easier for your patients and maybe your coworkers as well?
Yeah, they had me lead. I used to work in my department. I was one of the leads in the UBT team. So it's a unit-based team. And what we would do, I would be the front line to bring the ideas or whatever challenges that the department may be having. I would bring those ideas on how we can make the department better to management. And I just always wanted to create a positive workspace for the rest of the employees around me. And I was able to do that by us working together. People working Monday through Friday, 5 days a week, 40 hours. We have our own personal issues that we go through. So when I come to work, I will always want it to be a good environment for all of us and us working together. So we would do things like do giveaways like gas cards, treat each other to lunch, just to have a positive environment with each other. So.
Definitely, and that helps when, we spend so much time with people when you work in these settings that, they become kind of family as well, and if not, they just become someone you need to get along with for a long period.
Right.
Right?
Right.
Definitely.
Which can be difficult.
Exactly. It's making it harder for yourself when you work making things hard for everybody around you. But I get how you were able to help the front desk process, but how about when it came to actually the direct patient experience? Have you ever been able to implement something that maybe you could give other ideas to the other receptionists listening of ways to improve, just just someone checking in? What's something that you've been able to do to just improve that experience for them?
You know what is that is it's a process. It's a guide that we go by called AIDED: acknowledge, introduce, duration, explanation, and time. And what I mean by that is, when a patient is waiting in line, can't stand, we always want to acknowledge what they're going through. So as a receptionist, I will always, next member, I will be right with you shortly. And once they come up to the desk, I will always let them know, hey, you're checking in, your appointment time is around this time. It'll be approximately this long. And if it takes any longer than that, don't be afraid to come down and speak to me. I will get in contact with one of the RNs or management to see what's taking this appointment so long for you to be seen. So pretty much just having sympathy and letting the patients know that I understand what you're going through.
Right. And keeping them updated as
going
in
by
the
those
process.
Set of rules.
Right.
Absolutely. And I know that makes the patient experience a lot more pleasant and friendly when we show sympathy and acknowledge what's going on at the time of check-in.
That's a great point, and I like that you have an actual process that you follow. And I actually, in my book, I mentioned something that, and one of the key points is acknowledgement and just letting people know that I see you. We recognize that you've been waiting. Sometimes people are afraid to deal with those kind of situations in the office because they know someone's waiting and the people are staring at me, because they're waiting for an hour.
Right.
And you can't be afraid to address them and let them know what's going on because people appreciate being up to date. It's like, how would you want to be treated when you're sitting in an office? Maybe you're nervous, you're scared, or, something's going on with your family member. So it's definitely good to be kept abreast of what is happening.
Yes.
So for you, I would say this is probably a good question for the last couple of years especially. What changes within your medical facility that you're working with has been most difficult to navigate? And do you wish there were things that were done differently? And can you tell us something about that?
Oh, my God, yes. During this COVID time, it's been a lot of changes. Actually, dealing with the vaccine right now, it's been a lot more busier. So, meaning the lines are longer, wait time is longer, and I wish they can figure out how to get that time downside, with the wait. They put more kiosk in so that you're able to do self check-in. You can check in from the phone. You can check in at the kiosk, which we provide. And that sort of helps, but you do have some people that's not as tech savvy.
Right.
It's hard for them to use their phone and check in. So I see what they're trying to do, but I wish they can improve it some way, somehow. You understand? So to just get that time of standing in line and waiting.
Right. And that's what I was going to ask you. You mentioned the technology, with the kiosks and everything. And I was even thinking today, I said, a lot of times we think that older people have difficulty. And it's not just older people. It's just some people do not use a certain level of technology. They're not used to, I went to a lab recently and you had to put your ID down to be scanned, and things like that. It's going to require an extra layer of customer service to even help someone, do something that's supposed to be saving you time. So that's something that we work into, our offices and how our staff, kind of handles those things. So it's always good to recognize when someone might be struggling with the actual technology.
Right.
Yes, definitely. So, now, are you in a position where you find that your responsibility changes from day to day, or is it pretty standard of what your responsibilities are? Do you have to kind of jump in and take over and do other tasks?
You know what? Yeah, it's pretty steady, but there are times where I have to jump in and take over different tasks, not just checking in as far as going above and beyond, maybe walking a patient to another department because they're in the wrong department, maybe having to check in for like an X-ray or something, and something out of my scope that I don't normally do.
Right.
And which I know how to do, and I'm trained to do it. But I believe that's what a receptionist is. Sometimes you have to go outside of your scope, whatever it takes to help the patient, because that is the most important of the job, is taking care of the patient. So, yeah, from time to time, I do go out of my scope, but I don't mind.
Okay, that's good. And that's the truth. In any area of healthcare, we end up going above and beyond, and that would be the goal, right? If you're probably in the wrong industry if you're not willing to do that at some point.
Absolutely.
So after 11 years, right, what has been the biggest or most influential lesson that you've learned working in healthcare in the capacity that you've had the opportunity to do so?
I would say to not assume. And let me explain when I say not assume. I assume that I don't care how happy a patient is coming in. I used to always assume that they're good, they're not going through anything, until I saw a video of these different scenarios of patients coming in. They might be coming in just to have some blood work, and it will show their thoughts. So, like, say you, Shivhon, you came in. I don't know that you had a loved one that just passed 3 days ago. So I don't know what you're going through when you come in. So I can't assume that everything is A+ and is perfect in your life.
Absolutely. Right.
So, working in healthcare, and working with patients, I just don't assume anymore. I just have compassion and sympathy for everyone that comes in, no matter what age you are, how you look. That was like the biggest.
And I can identify with that, and that's such a great point, and it's so important because that is so true. You just have no idea where someone's coming from.
Right.
Experiences that they have had, whether it be in the past or recently, just, being in a doctor's office or having blood drawn, like you said, or, anything like that. You think something is routine, but for that person, it might be much bigger than that. So to address everyone with that same level of, empathy and care, and compassion is so important. I'm glad you brought that up today. Yeah, definitely. So what about your current employer is keeping you most interested in being part of that team?
It's the consideration they have for their employees. You know what? Kaiser offers, if you want to go to school, they offer to pay. They offer, it's plenty positions for you to jump into. They
a lot of opportunity.
They really, really have compassion for their employees, and they acknowledge the hard work that we put in, coming to work day in and day out. They acknowledge that. So, they make us feel like home.
Okay. That's amazing.
Yeah, and that's really keeping me there, and a lot of employers. I'm sorry.
Right. And it's great to have, that experience, because unfortunately a lot of people aren't having those same experiences with their employer. So it's great to know that there are places where you want to stay and you want to do well because they care about you and allows you to care for your patients.
Right.
What advice, would you give to new medical receptionists just joining the industry?
Oh, new members?
Yep, new receptionist or someone, first day on the job. What are you going to tell me? What's your advice to me?
I will say, you know what, Shivhon? Have patience. That's one. Have patience. Have compassion. And be as knowledgeable as you can, and don't be afraid to ask your fellow employees for anything that you need. So those are the three things. Have patience. Don't be afraid to ask, and have compassion. And if you don't have compassion for people, this is not the industry for you at all. So, yeah. And if you're
absolutely
in this field, you have some patience and you love people. So,
yes. I love that, and don't be afraid to ask. Those are wonderful points. Chris said, have patience, have compassion, and be knowledgeable. That means you need to learn what you're doing, the crowd that you're working with, understand what your office does, what kind of procedures they perform, what the processes are, and then you'll be golden, right?
Yes.
Absolutely. Okay, so most people don't realize I actually found Chris because I love comedy, and I was, finding different people to pay attention to on Instagram, and I came across Chris, and I started to follow, and then I started seeing these really funny skits, and they're all surrounding being a receptionist. So, and I'm like, there's no way he's a receptionist. Like, yeah, he's a stand-up comedian. He does all these other cool things. And then I realized, he is totally a receptionist based on the realistic depiction in some of the comedy skits. So you guys definitely have to check him out on Instagram at It's Chris Sneed, Sneed. But what made you start to actually bring your comedy, and join it with your other career in healthcare, and what made you start making those videos?
You know what, Shivhon? Yeah, it's funny. I'm glad you asked. In my comedy routine, I have one of my closing jokes about being a receptionist and checking in patients and working in pediatrics. So that closing joke has been so big everywhere I go, whether it's out of state, because it's a hospital and a medical facility, no matter where you go. So me using that in my routine, it was so big. I said, you know what? God put it on my heart and said, you know what, Chris? Bring the people in your world on social media.
Right.
So I just came up. I had some time off. I hadn't been at work in months. I had some time off, and then I just started shooting these sketches. And
that's amazing.
And people start sharing them, and and it's nothing like telling your truth.
Right.
I'm more funnier when it's really my life, and nobody can take that from me. So I started doing these sketches and fell in love with it, and there it was, man. I got a lot of followers, a lot of RNs, LVNs, doctors, physical therapists. Everybody in healthcare started following me and reposting it. So I just wanted to keep it going because, the fans of mine and people that follow me, they loved it. And I was brightening someone day, whether it's one person that's good for me. So.
Right, absolutely. And, I love all the skits you do. They touch very close to home, and I'm sure when our audience gets to see some of them, they will identify and have lived those experiences. And it's, great to put humor to certain things because, this is our real life, but you have to understand that there's always going to be something that we can laugh about. And one of the things that I like is that you are a receptionist, which, there's not, the reason I even started the Medical Receptionist Network, like there are not a ton of resources, whether it be serious and or funny for the receptionist, right? Doctors, nurses, they have organizations, they have all these things, and, they have people that do what you're doing, but for them, and there was nothing for the receptionist. So I just love that you have brought light to that. And I guess we're similar in bringing light to, the importance of being a receptionist. There's so many responsibilities that come along with that job, and definitely the first person most people talk to and see when they come into these offices. And so I appreciate that you have been able to bring the lighter side to that, and I can't wait to share this with everyone. Is there anything else that you'd like to share with us, whether it be about comedy or being in healthcare? Because I think I have one more question, and then I'll be all set and let you get on with it.
Okay. Yeah. You know what? I will share. I have a comedy special coming out. It's called I Need Urgent Care. It is not just about working at the hospital. When I say I need urgent care, we all need help in some area or aspect of our life. We can't do this alone. So that's pretty much what my special is about. The things that I've been through, working at the hospital, dating my kids. So we all need help. So I would like to share that. That will be coming out this spring when I record it. So I just want people to stay on a lookout for that. And also follow me, share my receptionist sketches. I have a lot more coming. Just like, share, comment, because we are much needed, and some receptionists feel like we're not valued as much as the RNs and the doctors. And I just want the receptionists to know you are valued. We are right there in the front, like you said, Shivhon. We are the first people these patients see when they walk in. You know,
absolutely.
And for them to get to the doctor, they have to be checked in, and someone has to check them in, and that's who? The receptionist. So
exactly.
Yeah, like and share, follow me, and
definitely. And I'm gonna make sure I'll make sure I have all your information there, and then when the special comes out, we'll update that as well. But so one of my questions, because it may be different, we're on different coasts, but I've been in healthcare since over about 20 years now. I have only met maybe 2 male receptionists. Have you ever found it hard to get interviews or to, even be, become a candidate? I'm sure once they meet you, it's like wonderful, but even as a manager, I remember, I think I've interviewed only one gentleman during my entire career, because they're just so far few between. But, this is an industry that for everyone, you know what I mean? If you're someone who wants to care for people and have, like you said, the patience and the compassion, I would hope that it's, could be welcoming to everyone. So have you had any experience, that you thought was specific to you being a man?
Yes. And it's the same here. It's not that many male receptionists.
Has that been difficult for you navigating, trying to gain employment or having, meeting with people and, having any experiences that were specific where you knew that maybe because you're a man that they didn't necessarily go with you right away, or they were a little more cautious?
Oh, yeah. Working OBGYN, they were a little more cautious. These women come in for women reasons, and me being the only male working with 2 other women, it's 3 men, 2 other women. Yes, I had women say, you know what, I'd rather not go to him. I'd rather go to her. So I've seen that several times, even though they do have male OBGYNs.
Right.
Male OBGYN, why you can't let a male receptionist check you in?
Exactly.
I'm missing your chart. They need what else?
Right, exactly. And I guess, right, exactly. But I had to bring that point up, and I thought about it, and I said, it's so rare that I'm going to bring it up, because I know that our, this industry is dominated by women. It's just the same with nurses, the same way, So
right.
I wanted to make sure, and men, if you're interested in this industry, I would say go for it if you are someone who can actually do the job, and don't be afraid to do it, because sometimes it's nice, we need everyone who cares about people to be in the industry that they deserve to be in. So don't be intimidated. And you have a great example here of Chris, who has worked with pediatrics, obstetrics, and oncology, some of the most important, specialties that we could even speak of. And Chris, I want to thank you so much for being on the show today. Everybody, you can follow Chris on Facebook, Chris Sneed, YouTube, Chris Sneed, SNEED. We will share his Instagram and everything else, and hopefully we'll get to see your I Need Urgent Care special coming up soon. And thank you so much for being here. I appreciate your time today.
And thank you for having me, Shivhon. You have a blessed rest of the day. I appreciate you.
You as well. Take care.
Thank you for listening to another episode of the Medical Receptionist Network podcast show. Don't forget to visit our website, medicalreceptionistnetwork.com, and subscribe to our newsletter. If you're looking for a great resource for medical receptionists, make sure you grab your copy of the Medical Receptionist Handbook to Success, available on Amazon. Lastly, if you have not subscribed to this podcast, please find us on your favorite podcast player and subscribe today. Until next time, keep being amazing.